One of the things that has happened in biology that I think are fascinating is for the first time we can begin to see what I call big problems that we can put together the new mathematical, the new computational, the new biological, and new medical approaches we need to, in a very coherent way, to begin solving them. And what is critical is to do this in the context of a cross-disciplinary, intimate environment where there is a close collaboration and interaction of scientists. But even more than that, as Lee Hartwell pointed out, since no institution has all the talent necessary for a big problem, such as P4 medicine, this predictive, preventive, personalized, and participatory, what we have to think about in a brand new way are strategic partnerships. And I would say, to give you an example of a strategic partnership, about 6 years ago, I went around and visited many of the nanotechnology centers, picking out one young person who I thought was among the best in the world for developing the nanotools that are going to make these blood measurements. And in a similar vein, I looked at people who are going to be doing in vitro imaging, and we put together an alliance with Caltech and UCLA, Jim Heath and Mike Phelps, that I think have uniquely over the past 3 years made enormous progress. We're in the process of doing this with computers and mathematicians right now. And my argument is we have to think in new ways about partnering. Not only academics with academics, not only academics in one country, but reaching out to where are the best people in the world, not just where are the best people in the country. And beyond that, how can we set up new relationships between academics and industry so we can begin to channel the enormously successful ability to invent the future in a coherent and really efficient way so we can make the conversion to P4 medicine. And of course, how are governments going to enable and facilitate these strategic partnerships? And again, they have to think beyond the narrow boundaries of their own country to argue we have to do these things with the best. We will see within the next 10 to 20 years the digitalization of medicine, a digitalization that will let us assess the information content of individual molecules and individual cells. And that will lead to a transformation far greater than the digitalization of communications and information technology, for it affects at the most fundamental sense all of our lives. And in that regard, this digitalization together with new systems approach to medicine, I would predict will alter the inexorably increasing cost of healthcare and turn it around for the first time. Why? Because we can create drugs less expensively, we can deal with side effects more effectively, we can stratify patients, we can make enormous numbers of measurements very inexpensively, and ultimately, of course, the reason is preventive medicine is much less expensive than responsive medicine. And the transformation, the globalization of medicine, of course, will allow us to export that medicine to the 45,000 uninsured here in the States and as well to the developing countries of the world. So I just leave you with the thought that we are possibly uniquely positioned here on the Pacific Rim. We're a site of ferment for a lot of these kinds of ideas. And I think with the new science, I think with the new technology, and I think with new kinds of strategic partnerships, we're in a terrific position to invent the future and globalize medicine.